Right, so when it comes to media bias, one of the first outlets that gets pointed at, and not for no reason, is the one we all pay a levy to keep going, the BBC. The licence fee, part of the reason so many of us get so angry at it, both on the left and on the right as it happens. Some might call that the very balance that the BBC is supposed to maintain, but when you're balancing opinion by everybody hating you, that can't be right, can it? But a report on Physicians Associates, fake doctors in our NHS by a BBC reporter is gaining significant notoriety, not only because of its inaccuracies, but the fact the reporter in question, Gem O'Reilly, appears to be blocking anyone pointing these shortcomings out. Why have the BBC not stepped in here? Why are they apparently happy to keep supporting a report that doctors that are reading it are actually slamming? We need more real, properly trained physicians, not fake ones, doing the same job with less training and undoubtedly for less money, because this will cost lives. So what gives? Right, so Physicians Associates, anaesthetists associates, the terminology is getting a little bit more traction. More and more people are hearing about these things. They aren't doctors, but you'll be fooled into thinking they are if the government gets away with it, especially given that government have legislated for the General Medical Council, the GMC, to oversee these people, regulate them, when the GMC is the regulatory body for real doctors only, or at least that has been the case up until now. Let's not beat around the bush with this. Like nurses, there has been a steady decline in doctors' training places in this country, despite the clear and obvious need for them. There has also been a bottleneck created for employment of said doctors, which, given the shortages, you might think sounds a little bit crazy. But when there's a cheaper option on the horizon, perhaps makes more sense because no longer is primary care an altruistic health of the nation issue. It's all about business decisions these days. Who's making money out of it? Because this is what always happens when shit gets privatised, and it's been happening by stealth for ages in our NHS, from hospital services being outsourced to external private health companies taking over GP surgeries and chains. Now, knowing that, it might stun you to realise that of the doctors who applied for GP posts last year, 6,500 of them didn't get offered a place. It's not like the vacancies are not there. We know they are, and getting there in ever-increasing number. But general practice takes more training than any other NHS doctor post. Training posts are not there. They're not being made available because NHS England is refusing to fund them. And if you think when I refer to NHS England that I'm referring to the NHS itself, I am not, because NHS England is just the quango set up by government to oversee pretty much the privatisation of the service by stealth. Actual doctors are more expensive to train and warrant more pay than, say, a quick and easy solution like a less well-trained, less well-paid alternative that's being passed off as a genuine article. Fake doctors. If ever there is a term that should strike fear into anyone, it's fake doctors. An inadequately trained medic being put in charge of your health. There's only one road that leads down, and that's a two-tier NHS where you can pay for a premium service where you get an actual doctor, NHS Prime perhaps they'll call it, or if you don't or can't afford it, well, you'll get whoever you get, lottery, doctor or not that they'll tell you otherwise. This is going to be a massive scandal, and the BBC, well, it's been found wanting when it decided to cover the story because it is biased as sin. Have a look at this and see what you think.
Well, Jem joins us now from the newsroom. So describe to us exactly what a physician associate is.
Physician associates have been working in the NHS since 2003. They can examine, diagnose and develop treatment plans for patients. They cannot prescribe and they cannot request ionising radiation, which involves CT scans or X-rays. Their work must be overseen by that of a senior doctor. The difference between a physician associate and a doctor is that a physician associate goes through a 2-year master's programme in physician associate training, but a doctor will have 5 years of med school and then clinical work on top of that. Physician associates do play an important role in the NHS when their work is supervised correctly.
The government began the legal process to set these new rules back in December. What's the latest line?
So the latest line that we have found out today is that the Academy of Medical Royal Colleges has backed the government's push to increase physician associates to 10,000 by 2037. Currently in the UK there are 3,286 physician associates. However, the Academy makes it clear that the scope of practice for physician associates must be outlined and that there must be clear guidelines as to how they're deployed across different trusts in the UK.
What are there other views on this? Tell us what else people have been saying.
So the British Medical Association is concerned about the new regulation coming in, which will involve the General Medical Council overseeing physician associates. They say that because the General Medical Council already oversees doctors, they believe that that will further blur the lines between doctors and physician associates. However, the Royal College of Physicians says that regulation is key for providing an avenue for potential complaints or any concerns that people may have.
And what about the families you've spoken to?
So the families are absolutely tragic cases, that of Ben that's in the article and Emily that you just heard there. However, they are isolated incidents and they are not indicative of a wider safety issue. Physician associates have told me themselves that they would welcome a more defined scope of practice. As I say, it is still, a very much positive thing that they're in the NHS, but doctors are calling for a much clearer defined role for these individuals.
Gemma Riley, thank you very much indeed.
So, having watched that, did you feel it was impartial? Gemma O'Reilly, the reporter there, to me sounded like she was reading from a prepared script given to her by NHS England itself. It really did feel like a setup more than an interview. Questions and answers all pre-prepared, and it was definitely anything but impartial. When you got past O'Reilly's explanation of what physician associates are and the concerns people have were discussed, for as much as she did say what those concerns were, there was always a but. There was always an however. O'Reilly pushed PAs as a good thing, but that they have been around since 2003, implying this is nothing new, that a reputable body, the Academy of Medical Royal Colleges, has backed increasing numbers of PAs. But then they would. They're training institutions. This will provide them with work. There are, as O'Reilly states, only a little over 3,000 of them to this day in the NHS, so that 2003 business is a bit of a deception when clearly these roles have only ever been a very minor thing in the NHS grand scheme of things, not very many of them. They've actually only been called physicians associates since 2013, because before that they were physicians assistants, making very clear their specific and far more minor role to that of doctors, and that the government's proposal to train treble that number of them now, well, all of a sudden do we need so many more of these fake doctors when we have actual doctors unable to fill roles because training won't be provided for them? Oh, but training will be provided for these people. 2 years of training for a fake doctor versus 5 years of medical school and then clinical training for a real one. Gee, I wonder why the cheaper option appeals so much to these money grabbers and privatisers. The fake doctor course is also apparently unaccredited. Just rub it in a bit more. It's a price that should be more obvious to everyone made aware of this properly, honestly and impartially, that the price will be measured in lives, not in pounds sterling. They must be overseen by proper doctors, we're told. They aren't allowed to prescribe, we're told. Their roles must be properly defined, we keep being told. But with cases of misdiagnosis already amongst PAs, fatally so in too many cases, this has not been happening. And again, with a shortage of real doctors, there's going to be a shortage of oversight, isn't there? It was when O'Reilly was asked about other views, though, that the bias really became apparent, I thought. She spoke about the BMA's concerns, the British Medical Council, the trade union of the doctors, their concerns being the muddying of the waters by having the GMC regulate fake doctors as well as real ones. Yet she chose to bring up the Royal College of Physicians at the same time as an answer to this, who have said regulation is key. Well, of course regulation is key, but set up another body to do it for these people then. Don't lump them in with real doctors. And why are you spinning that line anyway? Your job is to report the news, not offer up solutions on behalf of the government. It's their scheme. Let them sell it. It isn't your job to do that, so why are you doing that? Got worse than that though, didn't it? The Royal College is also going to be holding an emergency general meeting next week to discuss their members' concerns about this. It should be mentioned. The families of those affected by fake doctor malpractice, mentioning, albeit very briefly, a woman called Emily. This was Emily Chesterton, a 30-year-old actress who went to the doctor with leg pain. Thought she'd seen a real GP, but instead had been seen a PA, unbeknownst to her, who diagnosed her with a sprained ankle. She had in fact got a blood clot, which, undiagnosed, sadly proved fatal for her. The pain, incidentally, was in her calf, which is where clots usually appear when you get them in the leg. So how an ankle sprain was diagnosed from that, I can't fathom. Basic anatomy not in that training manual. But this is the risk to the public the fake doctors pose. Instead, O'Reilly othered this as well. And this actually angered me more than anything else in her report. Isolated cases are not indicative of a wider problem, she said. Again, why are you making excuses for government policy when you are just supposed to report the news? Why is the BBC seemingly so hell-bent on selling this idea? Why has this report been allowed to even stand? Why has the BBC not taken it down? She even ended her spiel by saying physicians' associates are a very positive thing. That is not your place to say. What professional opinion do you have on that? None. You aren't a doctor. You're more a spokesperson for the Tory Health Department than you are any kind of journalist to boot. And it is certainly in that vein that Gem O'Reilly has come in for a lot of criticism for her report. She's ever so proud of it, though. It's her pinned post on Twitter, don't you know, which she evidently cannot take. Dr. Matt Neal, for example, of Doctors Association UK, tweeted out to her in reply to that video clip that, Gemma, this is really disappointing. Unfortunately, Doctors Association UK didn't hear from you, but we could have shared significant evidence that these are not isolated incidents, and are in fact the tip of the iceberg. Much of this feels like you are regurgitating as fact the fiction that's been put out by PA groups. And it really did. She sounded more like a representative than a so-called impartial BBC journalist. Perhaps that makes her the PA equivalent of a journalist. At any rate, O'Reilly appears to be blocking any and all people who are calling out her PA advocacy in her reporting. GP Hannah Edwards wrote after she got blocked that seems like Gem O'Reilly has blocked every doctor who raised any valid concerns about her reporting yesterday. I commented about valid concerns we've raised about GMC regulation. How is this balanced reporting if any polite, reasonable questions are just blocked? BBC News, do better. She's far from alone. A lot of people are reporting that they've been blocked by O'Reilly as a result of daring to pick her up on her reports. And indeed, that pinned post of hers has had the comments turned off of it now, certainly implying she's got her fingers in her ears going, la, 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 I'm not listening. Is that the level BBC News reporting is at now, is it? People have died. If more of these fill more of the roles genuine doctors should be, more of these PAs, then the BBC are going to be making excuses for that as well, as this report should be making abundantly obvious. This sort of reporting, in my view, is endangering lives because people need to know that the person they go to and think is a doctor might not be. And they aren't going to be in a hurry to tell you otherwise. This isn't just a scheme being pushed and supported by the Tories either, because, as you might have expected, when doesn't Keir Starmer agree with the Tories? Labour also support this, and therefore the guaranteed continuation of its rollout, if Labour get into power, is seemingly assured. And all the details of that can be found on this video recommendation here, and I'll hopefully catch you on the next vid. Cheers, folks.